Thank you, ladies and gentlemen. I bring before you SB4 and SB5. I believe Mr. Chairman will take SB4 first.
All right.
Thank you. SB4 deals with the constitutional amendment to exempt diapers and feminine hygiene products from state sales and use tax. I believe there's an amendment, Mr. Chairman.
Yes, there is an amendment. Ms. Hess, you have the amendment. If you could quickly explain it.
It merely changes the effective date of the constitutional amendment from, I believe, January 1st, 2020 to 2021.
And I can explain that if you'd like, Mr. Chairman.
Yes, go ahead.
Essentially, the bill in its current posture, the enactment date will begin halfway through the fiscal year we're currently budgeting. By moving the amendment to 2020, by moving the bill enactment date to 2021, that means that it will go into effect halfway through the next fiscal year, which would allow the legislature more time to incorporate into the budget next year when they are in that session.
Okay, but it wouldn't take effect. I mean, it would only the legislature would only have the right to waive the sales tax if the constitutional amendment passes. Is that right?
Well, the constitutional they can't waive it, but what it would do is it would give the legislature the opportunity next fiscal year to incorporate it into the budget versus doing it this year halfway through the year should the people pass it. Because obviously what would happen is that mechanically this would be on the ballot this fall. If the people were to pass it and the enactment date was in effect, it would put almost contingency on the budget, and that if it passed, you'd have to come back in January to incorporate the exemption into the budget, which would lead to a little bit of uncertainty in budgeting. By having it pushed off till 2021, should the people of Louisiana decide to enact this exemption, the legislature, when it comes into budget in 2020, would then know they have to budget it for mid-year in 2021.
And I know you've been a big advocate for this.
I have.
And you're knocking this one with a big stick to put in the Constitution.
Honestly, as you know, and I try to be consistent, I have always said that when you have exemptions on essential items, you should give the people of Louisiana the opportunity to vote on that. We have put prescription drugs into the Constitution because we believe that's an essential item that one cannot operate and live without. For those of you who've had children or have older relatives, diapers is not optional. And for those of you, obviously, you know that feminine hygiene products are not optional. So just like prescription drugs are in the Constitution because they're deemed as essential items, specifically these two items, in my estimation, are essential and rise to that level, and we should not be charging people the state sales tax on those particular items.
Okay, and what's the value of the exemption?
It's about $9 million.
Okay. All right, Senator Appel.
Oh, no, I'm sorry, I didn't have it.
All right. Senator Barrow.
Mr. Chairman, I'd like to offer these amendments.
Okay. Yep. All right. Senator Barrow offers up amendments.
And at the proper time, I'd like to move favorably.
1165. All right. Is any objection to those amendments? All right. With hearing no objection, those amendments are adopted.
So, Mr. Chairman, if there's no opposition, I would like to ask that we approve Senate Bill 4 as amended. Certainly, these are essential items, and this is just another tool to help women who may be struggling just to have the basic necessities of life.
Any other, Senator Appel?
I'm just wondering, by doing what we've done with the amendment, haven't we just pushed this on to, if it's approved, then it's a mandate. Am I incorrect?
It was a mandate at all times. All we changed was the enactment date.
No, I'm just asking you. It's a mandate on a future legislature we're doing?
Well, regardless of whether you pass it now or whether we kept the amendment or not, it would always be a mandate on a future legislature. Just simply the enactment date changes. So if we pass it as is, it would be incorporated in this year's budget as well as future legislatures anyway. So it's going to be a mandate on future legislatures regardless.
I'm just wondering if this isn't the equivalent, Mr. Chairman, of what we do all the time with our standard procedure. And that,
for the stack.
Yeah.
Right. And I think that would be correct, except the only thing is this one, the reason why I didn't have a problem with it when we put the amendment on there is because if you don't do it this way, it would actually affect the fiscal year that we're talking about.
I understand that, but we're still in effect
and
mandating a future legislature. We're not allowing them to appropriate. We're telling them.
Regardless of whether you do it this year or next year, you're mandating a future legislature. I would counter that. The reason why I would not consider this, and I appreciate your stacking policy. I send plenty of bills here to get stacked. However, this is a constitutional amendment, so in effect, the legislature is not mandating this exemption. The public has to vote in all 64 parishes to determine whether or not it would happen. It simply gives the legislature more time, should the public grant the exception, to incorporate it into budgets. That's what the amendment does. My understanding is the amendment's already been adopted. Is that correct, Mr. Chairman?
Right.
Okay.
Yeah. So I mean, I guess the difference is, Conrad. I mean, Senator Appel, is that we're going to allow the public to tell us whether or not, it's almost like a referendum on this issue.
Right.
So.
I mean, essentially, I believe it's important. It is just as likely the public might not share my position, or that I believe that is important as it is, and they could reject it. But it puts the public in a position of determining whether or not they agree, like prescription drugs, this is an essential item that should not be taxed. I know there was some question, I just talked to Senator Barrow about local governments and whether or not they'd be allowed to collect the tax. In the companion bill, the language mirrors prescription drugs, where it's optional whether the locals want to opt in or opt out, because historically as a legislature, we don't make the locals do the exemptions we do. We give them the authority to locally determine whether or not they want to grant the exemption. That's covered in the companion legislation, just in case you were contacted by your locals.
All right. Senator Hewitt.
Thank you, Mr. Chairman. So how do we decide what are the essentials? Senator Morrell, there's baby food's an essential item. Is that tax exempt?
I do not believe so, but I can check. If you believe it's an essential item, you could always author a bill to exempt it.
Yeah, I was kind of leaning the other direction. I mean, I think that from a tax policy standpoint, I think we're making things more complicated by adding more and more exemptions. And so I'm not sure that I completely understand the definition of what's essential.
I would deem that baby food, I would argue, is in a different category, but one can take existing food, which is tax exempt, and turn it into baby food. One cannot make, I guess one could make homemade tampons. I don't think that would go very well.
It wouldn't, but you could use cloth diapers like we did back in the day.
And cloth diapers would also be exempt under this legislation. So, if your suggestion is that poor women should go make their own cloth diapers, I think that is a position. I don't think it's a realistic position, considering my wife and I actually did cloth. The amount of money you have to pay for the chemicals, additional items to sanitize cloth diapers, to make them available to be used on children without creating rashes and the like, is very expensive. Honestly, if you did all the things required to do cloth diapers and maintain them and measured it with disposable is measurably cheaper. So, though cloth diapers are better for the environment, mind you, like many organic things, it's not the cheaper alternative. And I think that part of this goal is that, I don't know if the Junior League is here today. The Junior League of Louisiana has diaper banks in each city. And they give away, in metropolitan areas, over 400,000 diapers a year. There's obviously a need where people are not able to afford diapers and are forced to go to a bank to buy them. And let's be honest, diapers are expensive. And for a poor family, although for many of us, $4 or $5 in sales tax is not a lot, for a poor family, $4 or $5 sends them to the diaper bank. And the reality is, if we've already described, I hate to use this analogy because it's the one I use all the time. If we think Viagra should be tax exempt, how can we say diapers and tampons shouldn't be? And like I said, this is not a statutory exemption where the legislature is picking winners and losers. We're putting it for the people of Louisiana to make that determination for themselves. So if they believe that this is an essential item, they get to weigh in on it. If they believe it isn't, then they get to say it's not. So, I hear you. I think we have a difference of opinion on this, but I think the people of Louisiana should be the final authority to make that determination. And as the chairman said, I think, and Senator Barrow said, there's literally no opposition to this bill. Even when we're doing other exemptions, someone shows up and goes, "No, I don't think you should do this." There's literally no opposition to this bill. Except for you. Sorry.
You might just cause me to oppose it just so we can see.
Okay. Appreciate it.
You know, when you look at the money that we're talking about here, we're talking about on feminine hygiene products, just based on the fiscal note, you're talking about a savings in state sales tax of 27 cents per month.
If your argument is that people are paying enough in taxes on this item, I would argue that we have a fundamental disagreement on when in the state should and should not tax. As I said, I think the real savings in this bill is probably on the diapers, to be honest. But at the end of the day, like I said, my position has always been consistently on taxation that when it comes to items that are deemed essential, like prescription drugs, that is the reason why they're put in our Constitution, because we have decided that as a legislature and as a people of the state of Louisiana, this essential product should not be taxed because it should be treated like other essential items. You cannot operate in society without diapers and without feminine hygiene products. It is not possible. And if they're essential items, the people of Louisiana should have the opportunity to vote and decide whether they agree that's essential. Otherwise, it'd be a statutory exemption, which I did not go that route because
We're not brave enough to pass it.
well, I did not say it. But what I will say is this: nationally, throughout the entire United States, there is a bipartisan effort to address this issue because many legislatures also agree these are essential items. And in states where they have prescription drugs as an exempt item, they're across the country also putting especially feminine hygiene products in because it is an essential item. You cannot operate in society without feminine hygiene products.
And maybe we do differ just in our overall philosophy about whether essential items should be tax exempt or not.
I think that's probably fair.
And the definition of an essential item. So yes, I do agree that these are essential items. I think there's lots of essential items, and I don't know where you draw the line.
I think we agree that we disagree on what's essential. I think that this is a pretty bright line.
A pretty what?
Pretty bright line as far as what's essential. I mean, when I think of an essential item, the two criteria I personally use is one, would you consider someone able to operate in polite society without it? And two, is there an alternative, a cheaper alternative, or an alternative at all? When it comes, like you said, baby food, you can literally mash your own baby food if necessary. You can make your own baby food, and some food is tax exempt. So I could argue that's already covered. You can't make your own tampons. And as I stated previously, for those of you who have bothered to attempt to use cloth diapers, ultimately they end up being more expensive than the disposable alternative. And if you talk to anyone who deals with, I know many of you have grandchildren, many of you have children. Diapers are not cheap. They are essential, and you cannot operate without them. And as I said previously, feminine hygiene products, you cannot operate without those as well.
Yeah, I think the challenge with doing it through a constitutional amendment is that you're not asking the people for the $9 million less in state revenue, what are you going to cut?
Well, considering this would go into effect in 2021, according to REC, we should have a $120 million surplus in 2021, so I don't think he'll be cutting anything.
Well, you know as well as I do that the forecast changes considerably, even from week to week. I don't believe you can count on that several years out from now.
We can have this argument, but REC is usually off by 5%. You would need it to be significantly off by more than 5% for this not to fall in a surplus year. Now, that does not stop the legislature at some point between now and then for breaking the budget, but you can't budget for the Louisiana legislature breaking the budget, or else we wouldn't do much in this building.
No further questions.
All right. All right, Senator Barrow?
I just wanted to ask Senator Morrell, because I know that you have young children and they are in daycare. So doesn't the daycare, when you have to bring your child to daycare, you have to be responsible
Yep.
for
You have to bring
ensuring
your own
their
diapers.
diapers. And so this can actually, this can be an impediment for many families if they can't afford those diapers in terms of being able to even put their child in daycare.
In every daycare that I've experienced with my 3 children, part of the daycare agreement is you bring diapers, you bring wipes. And I cannot imagine the difficulty and embarrassment
Yes.
if you have a child that you're barely keeping in daycare and you can't make end meet to bring the diapers, or if you're breaking your back to put your kid through daycare and you have to go to a diaper bank to hope they have diapers in stock to meet the criteria. Because with most daycares, the moment you don't bring diapers is the moment they tell you have to keep your child at home until you have diapers. So you're 100% correct. It is a huge impediment for families. As we argue about early childhood, and we're going to do it for 1-year-olds and 2-year-olds,
Yes.
we also got to make sure they have diapers to go to those different programs we have, because in many cases you're responsible for bringing your own.
I just want to verify that we kind of went through a similar situation when my daughter forgot to send the diapers, and they called me.
So it's certainly part and parcel.
The diaper bank folks are here. If one of you could come up real quick, just I didn't know they had I didn't know we had such an organizations that provided that service. You still got some in diapers, JP?
Actually, my last one is potty trained himself, and hopefully he doesn't go backwards, because it is very nice to not buy diapers anymore.
I was so old when by the time I had children, I'm going to go from changing my own children's diapers to them
Changing your
changing
own
mine.
diapers?
Yeah. It'll be just a constant life of diapers all my entire life.
Just to be clear, it covers adult diapers too.
Okay,
so
I'm glad to
you're
hear that.
Good either
I'm
way.
going to get to be friends with the folks at the Ginger League. Conflicted out. Yes, ma'am.
My name is Danielle Sadowat, and I am chair of the Diaper Bank here in Baton Rouge. This year, we have distributed over 400,000 diapers just in Baton Rouge. That does not count the other diaper banks, New Orleans, Lafayette, and up north Louisiana. So we distribute actually to agencies who request those diapers from us. We're actually only fulfilling 1/6 of the need of what they ask us for. We get that money from Junior League, who gives us those dollars. We also do other drives throughout the community, different businesses to get those diapers. To Senator Barrow's point, yes, if you cannot send diapers to daycare, you cannot go to work. On average, of the 57% of parents experiencing diaper need, they say they miss up to 4 days per month of not being able to go to work because they can't afford the diapers. So while this seems like an exorbitant amount of money that we're asking the state to give up $9 million for these sort of things, it's not for these parents who are in need. I actually work at a grocery store chain here in Baton Rouge in lower socioeconomic areas of this town. We find a lot on the shelves, diapers get popped open and people will take 2 diapers. They don't steal the whole pack, but they just take those 2 diapers that those babies need and, change them in the restroom. So I can see it, which is kind of how I kind of got into this, helping with this situation, because I see it day to day here in town through my job. And I also see it with these agencies. Most of our diapers, a lot of our diapers actually go to the YWCA, which sends diapers to the Head Start programs here in Baton Rouge. So that's kind of one of those things that we a lot of our statistics are coming from the National Diaper Bank Network, because this is on a national level trying to get different funds and whatnot for diapers, because there is no governmental assistance whatsoever for diapers. So you would actually be leading the way in helping those families in need.
All right. What is a typical cost of diapers for a kid?
It's about $100 a month
Okay.
per family for diapers.
All right. Senator Hewitt?
Thank you. So, according to the fiscal note, the state would be saving the family would be saving 65 cents a week by not paying the state sales tax.
In my opinion, I think it would be more than that.
I think it will be more than that too. I mean, a pack of when my son was in diapers, we went through a pack every 2 weeks, and a small box of diapers is easily $25. and the state sales tax on that obviously is more than 65 cents a week. So maybe the person who wrote the fiscal note has not had children since the 80s, but that number is way off.
So if that number's way off, then the $9.6 million is way off. It's been understated also then.
It could be, but what I would say is this, Senator Hewitt, is that, like I said, this goes to a vote of the people. The people will determine it, and also, because of our own REC forecast, this will not result in the deficit to the budget. But as I said, I think we have a fundamental disagreement on whether or not it's an essential item worthy of going to the public to be voted upon, and I don't know how to resolve that today.
And I guess I'm trying to talk about, I know diapers are expensive, and I can appreciate that. I'm just not sure that the saving the state sales tax is a game changer for those families, either with the diapers or the feminine hygiene products. I don't know that that's going to make it any more affordable.
I think that if your position is it's not enough money to be worth it, I think that if you were to put yourselves in the shoe of a poor family trying to scrounge together the dollars to pay for things and make ends meet, I think you're not adequately putting yourself in their shoes. Also, additionally, I would simply state that at the end of the day, we did not make that same argument on prescription drugs, because when you look at generic drugs and what actually the copay is on it, generic drugs, in my opinion, are cheaper than diapers. And yet we determined as a state that we were not charged sales tax on generic drugs. I know for many of you who are on my blood pressure medication that I pay has a copay of $8. I pay that every 2 months, which means that the savings on that is pretty minuscule, but we determined as a state that prescription drugs are an essential item. We allowed the citizens of Louisiana to vote on that, and they agreed that that's an essential item. And I think if we were arguing as to whether or not it should be a statutory exemption, I think that there would be more merit to that argument. We're simply allowing the voters to determine if they agree that it's an essential item or not. They may not.
Can I speak? Statistically, 25 diapers a week are what a family is short and cannot afford, which is what the diaper bank tries to provide for these families. So actually, the sales tax that they would save on that at least reduces that number to probably about half of what they're saving. So that's at least, it's something. You know, every little bit helps them, and she can bring her kids, she can bring those packs to daycare, she can go to work. It becomes a vicious socioeconomic cycle if she can't provide diapers for daycare, because daycares do not take cloth diapers. Then if she cannot provide diapers for daycare, her kid cannot go to daycare. She's at home not working, and it becomes a very vicious poverty cycle.
And I'd like to also add, as an important point, ultimately, like I said, this goes to a vote of the people. They'll determine whether or not it's appropriate. When you talk about the state determining what its priorities are, what we put into the moral document that is our Constitution, we have established in the state, and I'm looking at Senator Tarver because he tells me every day that we are all about the babies, right? We're all about the babies. If we're all about the babies, making sure that the babies have diapers is very important. You can't really say you're about the babies, but diapers aren't essential. But like I said, I appreciate and acknowledge we have a fundamental disagreement on the essential nature of diapers and tampons. We have a fundamental disagreement on whether or not a savings will help a family. But I think that at the very least it's appropriate of a larger debate on the Senate floor. The constitutional amendment's a very high hurdle. Obviously, you need a 2/3 vote. And I think that it's important for us to allow that debate to take place. And I think, Mr. Chairman, that I've addressed the issue as far as why I think it's different than other items that typically are stacked.
Thank you.
Senator Tarver.
I believe that you were missing up here the votes when you were talking about little kids and by looking at this committee, but you picked them up when you talked about adult diapers.
But they're included.
Ain't that right, Donahue?
But they're included, Senator Tarver. So that should get your vote right there. They gotta be included. There are no more questions, and thank you for telling us about your organization. So, any other questions from anybody? Senator Barra moves that we report SB4 as amended favorably. Is there any objection? Okay, we have an objection. So, Jessica, if you can call the roll.
Senator Allen. Yes. Senator Appel. No. Senator Barrow. Yes. Senator Bishop. Senator Donahue. No. Senator Fannin. Yes. Senator Hewitt. No. Senator Johns. Yes. Senator Tarver. Yes. Senator White. Yes. 6 yeas, 3 nays.
Okay, so that bill is reported out favorably, and Joy Blanchon, Danielle Satawa, Susan East Nelson from the Louisiana Partnership for Children. The other two ladies were with the Baton Rouge Diaper Bank and the Junior League of Baton Rouge. Kevin Hayes is also here in favor. Stephen Wright with Louisiana chapter for
Pediatricians.
okay, for pediatricians. I don't know. Charmaine
Cassiope.
with United Health.
United Way.
United Way, sorry. All right. And Leslie Levoy, Education Reform.
Senator, put your glasses on.
I know. I've already talked about my diapers. I don't want to talk about my glasses. I'm not that old.
Mr. Chairman, my next bill is simply the statutory, the accompanying statutory bill. So, if what I would waive my opening because it's simply the companion legislation.
Ms. Hess, do we have to amend it like the
Yes.
other one? Okay. Okay. Well, Senator Barrow will offer up that amendment, which puts the bill in the same posture as what we just passed. Is there any objection to that amendment? Hearing no objection, that amendment is adopted. And Senator Barrow moves favorably on SB 5 as amended. Is there any objection? Hearing no objection, that bill is reported out favorably.
Thank
as
you, Mr.
amended.
Chairman. Thank you, members.